Well, hello, people. So excited about today. I'm Bonnie Church, and my passion is matching people to the resources they need to live a healthier life. And one of my favorite resources is this lady, Dr. Anna Garrett. So I'm excited to have her here today, and I wanted to give you a little background on Dr. Anna. Dr. Anna is a doctor of pharmacy and a board-certified pharmacotherapist. She's a certified intrinsic coach, which means she helps women create and stick to new habits. She's also a certified Nutrimetrics HP, which means she is schooled in functional supplementation and has access to nutraceuticals that meet her very high standards for quality and efficacy. But Dr. Anna's passion is this. She loves to help women to escape from hormone hell. And to feel amazing in their bodies and to rock their mojo through midlife and beyond. She authored the book Perimenopause, The Savvy Sister's Guide to Hormone Harmony. Have you ever heard of a better title than that? I think that was amazing. Many of you women ordered the book What to Expect While You're Expecting as soon as you found out you were pregnant, like day one, right? Well, Dr. Anna's Savvy Sister Guide is a much needed compendium of everything we need to weather the other end of our reproductive years. Along with Dr. Anna, I put together a Savvy Sister Collaborative here. Women of the world unite. And they work with women who, and so they are going to be here to ask the questions they're being asked about this stage of life, this special stage of life. So our panelists include, and you can raise your hand when I say your name, Jody Cash. She's the owner of Train for Life in Boone, North Carolina. She's an integrative health coach and trainer who helps women get lean and strong as they learn to calm and love their bodies. So she's got a very special approach. And we have Nancy Gregory Smith. Nancy, she's the owner of Grace and Gumption, a wellness center for women in the greater Hickory area. Besides teaching wellness, fitness, and yoga, she works with Parkinson's patients in slowing down the regression of that life-altering disease. So that is an honorable work, Nancy. And we have Krista K. Smith. She's a registered nurse and a Nutrimetrics HP. She's been caring for moms before, during, and after birth for 25 years. I know she only looks like she's 25 years old, but nonetheless, she's traveled throughout the nation doing clinical research and has served as a medical consultant for many TV shows and movies. And she recently opened R&D Wellness, a functional nutrition coaching and IV hydration therapy or service in Wilmington, North Carolina. She's also an actress, a model, and a mother of 5. So we've got an interesting panel of the panelists here. So between us all, I figured out we have 125 years of experience. So that makes me feel very old, but all told, 125 years of experience, okay? So we're going to dive right in and cover a lot of ground, but don't worry about taking notes. When you receive the follow-up email, you'll have your recording and all the resources covered today. They're all going to be linked in that follow-up email. And I know some of you are on a lunch hour and might need to leave the webinar early. That's okay. The recording will get you up to speed on anything you might have missed. So are you ready to dive in, ladies? Who's ready? Raise your hand.
Yes.
Okay, all righty. I get to ask the first question, okay? I have a 3-pronged question, Dr. Anna. Perimeno or menopause, what's the difference and what happens to our hormones in each of these stages and what are the symptoms?
So first, I'd like to say thank you for having me today because I haven't seen you in a long time and I'm just thrilled to be able for us to collaborate again. So it's going to be a lot of fun. So this is a very foundational question and one that women need to understand. So perimenopause is the time from when your hormones start to shift, which can be in your mid to late 30s, all the way up to the time that you enter menopause. So it can be anywhere from 5 to 10 years for most women. For African-American women, it can actually go on longer than that. And then menopause is just one day of your life. It is the day that marks 12 months since your last period. And then everything after that is postmenopause. So In perimenopause, it is characterized by an overabundance of estrogen. And the reason for this is because you begin to ovulate less frequently as you enter perimenopause. And so you don't have progesterone to balance out the effects of estrogen. So essentially, estrogen runs the show all month in your body, and you begin to experience things like new anxiety and insomnia and weight gain and periods that are like a crime scene that may come, 2 weeks apart. So there's all kinds of, I think there are 34 symptoms of perimenopause, some of which are very strange, like a crawling sensation on your skin. And there's just some other really crazy ones, all of which are in my book. But so as you move toward menopause, your estrogen levels begin to calm down, but you still don't have progesterone to balance out your estrogen. And one of the problems that you run into if you're overweight, especially, is that your fat cells make their own estrogen. So they're like little estrogen factories, and you can stay estrogen dominant into menopause. But typically, menopause is characterized by a whole different set of symptoms, which would include night sweats, hot flashes, joint pain, vaginal dryness. So those are dry skin. So those are very, very common in menopause. So the picture just shifts a little bit. But our hope is, while all this transitioning is going on, that our hormone levels are coming down together and playing nicely. And, some women just stop having periods and they don't experience anything else, but that's only about 20%. And then some women are all the way on the other end of the spectrum where they become suicidal and just have really, really life-altering symptoms.
Wow. Yeah. Well, Jody, what is your question?
So I want to ask a question that a lot of my clients ask me, and that is, so what can we do on our own to help us get out of this hormone hell that we're experiencing?
That's an excellent question. So when I work with clients, it's really a three-pronged approach, and it starts with a foundation of lifestyle, because you can't out supplement either with herbal supplements or hormones a terrible lifestyle. So the first things I generally recommend to women who are struggling is to avoid alcohol, because just getting rid of alcohol can actually clear up everything. That's not true for everybody, but I've had it happen enough that, that's certainly one of my first steps. Stress management is huge, because in my mind, stress underlies all hormone imbalances, because cortisol, one of your stress hormones, is the only hormone you actually need to live. And so if your body needs more cortisol, it is going to make it at the expense of all of your other sex hormones. So managing your stress is critical, because that's also going to help your sleep. And sleep is a big problem for women in perimenopause. Eating a healthy diet, so limiting sugar. And in fact, I have women usually experiment with going gluten-free and dairy-free, because they are so inflammatory for a lot of women in midlife. And so I encourage my clients to look at their bodies as a lab and just sort of hover at a 30,000-foot level and be willing to experiment for a couple of weeks or a month with a certain lifestyle change, just to see what the impact is. There are essential oils that can be helpful. So clary sage is one that can help, especially with hot flashes and night sweats. Geranium is another one I like. Lavender, thyme oil. Those are probably the biggest ones that I can think of right off the top of my head. And there are certainly more depending on what somebody is experiencing. And then there are some supplements that I love. The first is magnesium. because it's calming and it can help with sleep. And our diets are very deficient in that because our soil is very depleted of magnesium. And it's also helpful for heart palpitations, which many women experience in perimenopause. I also like the Nutrimetrics Axe supplement. I use this a ton. I take it myself because it's such a nice blend of adaptogenic herbs as well as offering some thyroid support. And then Feminine, another Nutrimetrics product, has an extensive blend of herbs that have been shown to help with hormone balance, like Dong Quai. I had it printed out because I can't remember because the list is so long. But and then it's got vitamin E and some of the Bs because that's very important for hormone balance as well. So B6, B12. Vitamin C is helpful for adrenal support. So there's a whole lot you can do with supplements. And then omega-3 fish oil is something that I recommend a lot, just for joint health, for overall cardiac health. And then let me think about if there's anything else that I just truly, truly love. But it really starts with diet and stress management and trying to get as much sleep as you can. And people look at me and go, well, Dr. Anna, if I could sleep, I would. And I'm like, well, there are things like L-theanine and magnesium that can be super helpful for sleep. So it's very individual, but I look at every client as a puzzle. And so I like to put together those pieces in different ways to see what works for them.
Very good. I wanted to put in a plug too for a new product offered through Nutrimetrics called Access Mental Health Balance. And the reason I'm kind of fascinated with this, because there's probably a lot of women who have teenagers, young girls. My granddaughter is 12 going on 13. And this is a supplement. A lot of supplements you don't want to give to a child below a certain age, but this one is good for 12 and up. And it has, I noticed in your book, you talked about saffron.
Mm-hmm.
It has saffron extract, which has a calming effect, which, trust me, 12 and 13-year-old girls need. Okay. It has GABA, which, is considered one of the main neuroreceptors in the brain, and magnesium. So it's very calming and mood stabilizing. And for the young girl who's just starting her periods, they're on that end of the reproductive cycle. It's available too. So those were really helpful. Those were really helpful tips, Dr. Anna.
Can I talk about saffron for a second?
Yes. Yeah.
So I love, because I'm not familiar with this product. I haven't tried it yet with anybody, but I'm sure going to, because it does contain a therapeutic dose of saffron at 30 milligrams, which has been shown in at least one study to be as effective as Prozac. So I'd much rather have somebody be taking saffron than Prozac.
Right. And that's what I like about the Nutrimetrics line. They do some wonderful compounds for us. They do the thinking for us, and they're efficacious. They're offered at an efficacious dose. So that was very helpful. Okay, Nancy, I'm going to turn it over to you. What question did you want to ask?
Okay, so if self-care is not enough, where do we go from there?
So self-care is great. Then, as I mentioned, there's a layer of supplements that can be helpful. But beyond that, considering hormone replacement is an option as well. So I personally believe in testing hormones before you start adding things into people's regimens. There are physicians who would argue that point and say, well, your hormones are going up and down all month. And I'm like, well, but your blood sugar goes up and down all day. And we still use that as a marker for making therapeutic decisions about managing diabetes or any other blood sugar issues. So I kind of don't like that argument. Actually, I really don't like that argument, but there are different ways of testing hormones. So that can be done with blood and urine and saliva, each of which has their own pluses and minuses. And I won't get into all of that right now, just for the sake of time. But I personally use a test called the Dutch test in my practice, and that's a urine test, which allows us to see not only the absolute levels of hormones, although I'm more interested in the relationship of one to the other than the absolute number. It also lets us see the metabolic pathway. So how is your liver breaking down your estrogen? Is it being sent into the safest pathway so that you're not risking DNA damage from one of the metabolites that's, has a greater percentage than it should? Saliva testing is considered the gold standard for checking cortisol, but it doesn't give you those metabolic pathways for cortisol like the Dutch test does. So I just like it because it's very comprehensive. It's not great for follow-up in some situations, but I have ways around that too. So I believe in testing. Test, don't guess, because somebody may not need estrogen, especially if they're in perimenopause. If their estrogen level is already super high, you definitely don't want to add more into the mix. And then I find that in perimenopause, some women can get by with just supplementing progesterone, and that comes in topical and oral forms. The topical form is available over the counter from a number of manufacturers. Oral is a prescription item, and it is best for sleep. So my clients that need oral progesterone, I will work through their doctor to help them obtain that. And then in menopause, you generally are looking at more of an estrogen progesterone combination. And then you may want to add in testosterone and or DHEA, depending on what the situation is. So as your ovaries reach their retirement age, all of your hormone levels fall, and that's when you need to start supplementing to take care of symptoms like hot flashes and night sweats. But there's an increasing body of evidence that estrogen is excellent long-term for maintaining bone health and brain health and cardiovascular health. And those are all things that we want to maintain as we enter our 60s and 70s, because if you're anything like me, I want to be able to get out of a chair and have energy and do whatever I want to do. So going back to perimenopause just for 1 second, one of the most important things you can do as you enter perimenopause is to make sure that your adrenal health is tip top, because your adrenal glands pick up the slack on hormone production when you get to menopause. So if you've laid a good foundation of adrenal health, you are much more likely to have a positive experience than if you have not and you've waited until you get to menopause.
Oh, fantastic. What a great answer. Okay, Kristen, you had a question.
So you've touched on the benefits a little bit, but because I find that so many women are fearful of hormone replacement therapy, can you kind of give us the benefits and the risk of hormone replacement therapy?
So I could do the entire webinar on this question. Yes. So if we look at where the fear of estrogen comes from, it started with the Women's Health Initiative study in 2002, because up until that time, there were just millions of women who were on estrogen, seemingly without problems. So the way the study was designed, it was designed to look at the effect of estrogen on cardiovascular health, bone health, and breast cancer risk. And so I think it went on for like 18 months, and they divided women into two groups. One group of women had hysterectomies and they were given estrogen alone. The other group still had a uterus, and so they got a synthetic progestin, which is not progesterone, along with conjugated equine estrogen, which is derived from horse urine. Okay, so you had these two groups. And the study was actually stopped early because the women in the combined therapy group had an increased incidence of breast cancer. All of them had an increased risk of heart attacks, blood clots, and strokes. So the study was stopped early. The media went nuts. Everybody was vilifying estrogen as causing breast cancer, and on and on and on. Millions of women were taken off of estrogen, and, you know, all hell broke loose, for lack of a better description. But when they went back and did sub-analyses on the results, what they found was that the synthetic progestin was actually the bad actor in the whole situation. So it was the piece that was increasing the breast cancer risk. And this has subsequently been shown to be true for birth control pills that contain a synthetic progestin, as well as IUDs like Mirena and Skylar, and not with the copper IUD. So the pendulum has started to swing back. Is the risk of blood clots, heart attacks, and strokes still there? Yes, with oral estrogen, it is. Because when you take oral estrogen, it has to go to your liver to be broken down. And in that process, your clotting factors are affected, which makes you somewhat more hypercoagulable, meaning you're more likely to develop a clot. So that risk is the same. But with topical estrogen products, that risk is not there. And so your estrogen, if you're putting it on your skin with a patch or a cream or a gel, doesn't go through that same breakdown process as the oral form does. So the pendulum has swung. Now more women are being put on estrogen and progesterone, and there's a lot more science being conducted about the benefits long-term of both of those. So there's a book called Estrogen Matters, and it's by a physician named Avril Blum, B-L-U-M. And he actually looks at most of the data that's out there about cardiovascular health and bone health and brain health. And then there's also a book called XX Brain. It's over on my bookshelf, and I can't remember who wrote it, but it's very good as far as talking about the role of estrogen in women from the time you hit puberty all the way to menopause and beyond. So what are the risks? Well, the risks, as I mentioned with the oral, is the hypercoagulable state. You know, you'll hear a lot that you should not use estrogen if you've had breast cancer. And I would encourage everybody that's listening to go to YouTube and look for a doctor. Her name is Lindsay Berkson, Lindsey Berkson. She is a breast cancer survivor, in addition to being one of the mothers of functional medicine. She is on estrogen, and she goes, I don't know if she's done it on YouTube, but I've heard her speak several times. And there are no studies that show, even if you've had breast cancer, that it causes a recurrence. So that is outdated thinking, but you would be hard pressed, I think, to talk a physician, or most physicians, into giving estrogen after breast cancer. But I think that thinking is even starting to swing. With progesterone, the most common side effects are drowsiness, which is what we want, because we want people to sleep, right? But if the dose is too high, that can cause kind of a hangover feeling in the morning. And then in some people with a tendency toward depression, it can worsen depression. And then there's a small group of women who have premenstrual dysphoric disorder, which is like PMS on steroids. And they have a receptor issue in their brain. And this is not everybody with PMDD. They have a receptor issue in their brain where the receptors are not shaped correctly to accept the progesterone, and progesterone will actually make their symptoms worse. So if you ever see anybody who's on progesterone, which is supposed to be calming, who just gets much worse on progesterone, that's probably what's going on. So
Wow.
does that help? That's like the 5-minute tour of
a complicated
estrogen.
question. Yeah. So that was fantastic. Well, you know, you mentioned physicians, you know, showing some reluctance to prescribing hormonal therapies. What can a woman do to advocate on her own behalf with her physician, or What should she look for in selecting a healthcare practitioner that can help her during this stage of life?
Ooh, so there are several things. The first is to do a little research on your own. Now, doing a little research on your own can turn into a big rabbit hole on Google. So, but you need to kind of understand enough about what's going on with your body, which is, that's part of the reason I wrote my book, and I wrote it in a way that was accessible to people who were not medical professionals, so that they could understand what's going on, and understand the options that are available to you. And so what I encourage women to do is, if they're getting pushback from their doctor, to just present it as an experiment. Hey, could we try this for 3 or 6 months and see if I feel better? My doctor, I have an awful breast cancer history in my family, and my doctor was showing some reluctance to let me try estrogen, and I just wasn't having it. So, I actually took her my Estrogen Matters book, and I said, here, read this. And she did. And she'd already given me the prescription by then, because she knows that I've done the research and that, I was comfortable with it. But I think, even if you just familiarize yourself with the North American Menopause Society recommendations, which I believe were updated in 2021, just to understand what the current science says, so that when somebody's given you a 2002 answer, you can say, well, from my understanding, this is actually the current recommendations. If you can't get anywhere that way, then you may need to start looking for another physician who will help you out. I encourage women to look for somebody who's got a background in functional medicine, because they're more likely to be familiar with the latest science. We think of OBGYNs as the experts in hormone therapy, but the truth is, most OBGYNs don't have training in hormone therapy. So I think it was, I completely lose track of time, but it's probably 6 years ago that AARP did a study of medical residency programs, and just to see if hormone training was included. And so they surveyed OBGYN residency programs, and only 20% offered any sort of specific hormone training. And of that 20%, most of it was elective. And so we wonder, why our doctors can't help us. And it's not really their fault. They don't have A, the training, B, the incentive to go out and get the training. And they're working in a system where the typical office visit is 7 minutes. And so how do you even get into a conversation about hormones and what a woman wants for herself? So the easiest thing to do is to write a prescription for birth control pills or an antidepressant and send people on their way. And sure, those things are Band-Aids, and they may help with some of the symptoms, but they don't get to the root cause, which is low hormone levels or stress.
What a great answer. Okay, and we had some other questions too, you ladies, that you wanted to ask. Jody, you had a question.
Yes, I did. So how do I know if I'm in perimenopause? Women start having certain hormonal symptoms. They start seeing things going on, but they're like, I don't even know if I'm in menopause or perimenopause. How do I know that, especially if I'm still having a regular cycle or somewhat regular cycle?
Yeah, that's a great question. So somewhat regular, if you were always regular, would be one tip off. If you start experiencing new things like anxiety and insomnia, and you're in that late 30, early 40 window, it's a pretty good bet that you've entered perimenopause. One way to tell that would be to check your hormones on cycle day 19 to 21, assuming that you have a 28-day cycle. In my clients who are not regular, but are having cycles like maybe every other month, I'll sometimes have them use an ovulation predictor kit before they do the testing, because what we want to see is what your body is producing as far as progesterone goes. And day 19 to 21 would be about when your highest level of progesterone would be. So sometimes it's hard to tell, but if you just kind of have that awareness in the back of your mind of, oh, this is new, maybe I should be paying attention. So, and this is especially true if your periods get heavy or you start gaining weight for absolutely no reason. That could actually be a thyroid issue too. So that's something that needs to be checked out, because we have an epidemic of hypothyroidism in this country that's undiagnosed.
Very good. Nancy, you had a question from some of your people.
Yes, how can we track the estrogen or the progesterone?
So
If you had said something, if you had a partial hysterectomy, Nancy. Yeah. So
Yes.
someone who had a partial hysterectomy, ovaries, no uterus, how can they track?
So some people, even after they have a partial hysterectomy, still have cyclical symptoms because your ovaries are still producing the hormones. So a hysterectomy will take care of like heavy bleeding or fibroids or adenomyosis, which is tissue growing outside the uterus or into the uterine wall, and it causes heavy bleeding. But you may still notice, especially like emotional symptoms, or you could still have insomnia or anxiety, and they may have a cyclical pattern. So you can still do testing if you've had a partial hysterectomy, because you're still going to be producing those hormones. So that's how I would do it. And I work with plenty of people that have had partial hysterectomies.
Yeah, and I know there's a chapter in your book on if you're considering a hysterectomy, things that you need to think about. So
Yeah.
I definitely recommend getting the book. The book is so helpful. Okay, Kristen, you had a question.
Pregnenolone, a supplement which is sometimes prescribed as a precursor to progesterone. How do you raise the progesterone if a pregnenolone supplement alone is not working?
So I am not a huge fan of using pregnenolone because, so it's the mother hormone, so it can travel into any of the hormone pathways where your body needs it. And I, as a practitioner, have no way to control where it goes. So I only use that typically in women who have hormone depletion across the board, because it needs to go everywhere, right? So I'm more of a fan with progesterone of using the topical creams or the oral capsules, because I know where that is going to go. Now with progesterone, it's a little bit tricky because your body, if it needs more cortisol, it's going to take that progesterone. I wish I had the picture of the hormone cascade, but I don't right here. It's going to take that progesterone, and cortisol is right under progesterone in that cascade. So it'll take it and make cortisol out of it. For estrogen, I like using actual estradiol supplementation, whether it's a topical, patch, cream, gel. I'm not a big fan of oral, but sometimes that's all somebody's insurance will pay for. And so, you know, we have to do what we have to do. And then for DHEA, I tend to use the oral DHEA, testosterone. I would prefer to see somebody using testosterone cream. So, you know, pregnenolone can be kind of a renegade, just because you have no ability to control where it's going.
Very interesting. You know, I know there are a few people with us today who are in their mid to late 30s and they're considering motherhood. Are there any helpful hints for them?
Well, so obviously the older you are, the harder it may be to become pregnant. And if you are in your late 30s, you may have entered perimenopause and may not be ovulating consistently. So this is where an ovulation predictor kit can be very helpful. I would say making sure that your stress is managed very well, that your adrenal health is in really great shape, and that you're nourishing your body in a way that supports pregnancy. So I think stress is probably one of the biggest components of this, because if you're in fight or flight mode all the time, your body's going to go, oh, we got to fight the tiger. We don't need to be getting pregnant. So you have to create the conditions in your body to make it hospitable for a pregnancy. And that means keeping yourself out of fight and flight and being in rest and digest mode, which is your parasympathetic nervous system taking over. So just creating that good foundation and recognizing that it may take longer to get pregnant because of lack of continuous ovulation, potentially.
Great answer. Well, you've covered so much ground in such a short period of time, and we're gonna, when you get to your follow-up email, you'll have a link to Dr. Anna's book, Perimenopause: The Savvy Woman's Guide, The Savvy Sister's Guide to Hormonal Harmony, and it answers so many more questions in greater depth. And also, Anna does consultations, and she can work with you one-on-one. So be looking for that email. And we'll have all the links there for you. And I think drAnnaGarrett.com if you want to go directly to her website,
Yeah.
correct? Yeah. And also links to our panelists, their businesses, because we're really excited about the businesses that are being launched among us savvy sisters, right? So, well, that's all for today. And be sure to tune in to future podcasts. I'm already thinking I want to have you do a podcast on managing stress. And,
Oh, perfect. Yep.
So
Could
be
go
looking
on
for
all day
that.
about that too.
She's an expert on that. Okay, well, God bless you all and have a beautiful day. We're going to cut it off here. Okay.
Thanks, Bonnie.
All righty. Bye-bye.
Thanks, everybody.